let's look at postnatal care. My name is Dean Robina. We're taking you through this session. Um, in our previous recording, we have looked at postnatal assessments. So this time we are going to look at the kind of care that is given to the mother. So by the end of this session, we believe that you will be in position to provide the postnatal care to the mother who has given birth. So postnatal care extends from approximately 6 weeks after delivery. During this time, healthcare providers closely monitor physiological changes in mothers and infants, diagnose and treat postnatal complications, and provide essential emotional support, especially establishing feeding patterns and the offering guidance on contraception is also a key component of postnatal care. So basically, these are the things that we consider. We need to make sure that the mother is in good health. So during postnatal care, we provide both the physical and also emotional kind of care that the mother requires. So, serious postpartum complications include the following. We have postpartum hemorrhage, which is characterized by sudden and profuse blood loss or persistent increased blood loss. So, this normally happens when the mother has just given birth and she loses a lot of blood. So, the symptoms can include weakness, dizziness, and palpitations or tachycardia. The other serious postpartum complication is the infection. This is normally recognizable by fever, shivering, abdominal pain, and or offensive vaginal discharge, which normally happens after the mother has given birth. Pre-eclampsia, preeclampsia, postnatal onset of headaches accompanied by visual disturbances, nausea, and vomiting can be some of the signs that show this complication. But the major complication, right, the major sign is the high blood pressure. Principles of care: develop a documented, individualized postnatal care plan in consultation with the mother, which should be reviewed at each postnatal contact. So we need to make sure that this is the time we also employ our uh, nursing process knowledge and skills. So we need to make sure that we document and we plan the care very well before we provide. Then allow women the opportunity to discuss their birth experience, ask questions, and provide timely information to empower them to promote their own and their babies' health and well-being. So we give the women to share their experiences because there are many questions that we may have that are not answered, and there are many questions that the mothers may also have that are not answered. So this free interaction can create an environment where the mother will open up, and in case of anything that she needs to be explained thoroughly to her, she can be able to ask the questions and you give the explanation. So provide them the Department of Health booklet birth to 5 within 3 days of birth. So depending on uh, the system that is in the country, but in our system right here, we keep all the records with us, and the records are all kept in the department. So this will also depend on which hospital that you are working in. So make sure that you give women the personal child health record as soon as possible and explain its use. So the child health report is the one that will consist all the information about the child birth, whether the child has been immunized, the weight, and this will be used for monitoring the child until the child reaches 5. Yes, so this has to be explained properly to the mother so that she's aware about that. Continuously review women's physical, emotional, and social well-being at each point of contact. Parenting and emotional attachment. Postnatal care involves assessing emotional attachment between parents and their newborns. So, home visits are conducted to promote this bond, and mothers are encouraged to develop social networks. Group-based parent training programs designed to enhance emotional attachment and parenting skills are made available. So fathers are offered information and support to adapt to their new role and responsibilities. Make sure that at least in the family is not only the mother who is overwhelmed with the responsibility of parenting, taking care of the newborn, but all the family members, more so the partner, should give a hand to make sure that the baby is catered for well. Then immunization. Immunization plays a pivotal role in ensuring infant health. So, immunization has to be given immediately when the baby is born. In our local setting, we give the BCG and the polio zero at birth, and after that, we schedule for another meeting at 6 weeks. Then after that, it will be every after 4 weeks until the baby is 14 weeks. Then from there, the baby can be given at 9 months. But the growth monitoring has to continue until 5 years. So this has to be explained very, very thoroughly to the mother to make sure that she keeps on bringing the child for this. Then, in the previous recording, previous lecture, we talked about um, the rhesus D immunization. So this is also done specifically to mothers who are rhesus negative. There are those mothers who are rhesus negative and their partners are rhesus positive. Also those who are group O positive partners and they have their wives or the female counterparts are rhesus or rhesus negative. They need to be given the anti-D. If they are not given the anti-D, the subsequent pregnancies are likely to be affected and they may end up losing the pregnancies. Breastfeeding and formula feeding, timely information on breastfeeding and the timing of the first feed, ideally within 1 hour of birth, is crucial. It should be made available regardless um, of the care location. So, regardless of whether the mother is going to breastfeed or the mother is going to formula feed, the baby has to be fed immediately after birth. We encourage that within 1 hour after birth of the baby has to be fed to make sure that everything is okay. The baby is not exposed to any danger. Infant health and the well-being. Vital signs of infants after birth are monitored along with their general condition, social capabilities, and attachment. Proper hygiene and skin care are emphasized. So during this time, we emphasize because the skin of the baby is still delicate. We encourage mothers not to use strong cosmetics on the babies. At least to use baby products that are known to be soft and gentle on the baby's skin so that the baby's skin is not exposed to danger. The baby should not be exposed to too much coldness and should not also be exposed to too much hotness. So the temperatures around the baby should be regulated and the baby should be monitored every now and then. Problems to look out for: the slide highlights several common infant issues like colic, constipation, diarrhea, fever, jaundice, and the nappy rash. So these are the things that the mother should watch out for. The baby is likely to have colic pain, that stomach pain which is severe on the baby, more so when the baby is trying to feed, and sometimes can make the baby to cry throughout. Then the baby may face constipation, may take days or even weeks without passing feces. The baby can have diarrhea, fever, jaundice, and sometimes can experience nappy rash. So in such cases, the mother should consult and get the proper advice on how the situation can be handled. Mother health and well-being: as part of postnatal care, mother's health and well-being are equally important. These topics include physical recovery, emotional support, uh, family planning, contraception, and addressing any postnatal complications. Proper monitoring and the care are also very important. So the fact that we want the baby to grow up very well, it has to start with the mother, because the mother is going to be the primary caregiver to this baby. So the mother's health has to be in a proper line. More so, things to do with unwanted pregnancies that may occur have to be avoided, and in that case it will give the mother chance to take care of the baby very well, and any other thing that can affect the mother's health also has to be identified and dealt with immediately. So that marks the end of this recording. Thank you so much for attending to this. May God bless you.